The following case shows how primary care clinicians can work together to engage family members in treatment. Family engagement can occur at any of the following 5 levels. This video illustrates a Level 4 intervention, a systemic family assessment and planned intervention. In the video, you will see a medical clinician recognize the need for a patient to become more independent and physically active. Notice how the medical clinician engages the family and then collaborates with the behavioral health clinician. Here is a genogram of the patient and family. The genogram displays a person's family relationships and medical history. The patient, Becky, lives with her husband and oldest daughter, Christina. Becky has a history of cancer and depression, and a deceased daughter. Christina and Becky have a somewhat fused relationship, meaning that both individuals rely on each other to a point where boundaries between Becky and Christina may be unclear. The patient has a history of hospitalization for chemotherapy and a DVT. She also broke her ankle 9 months ago and had to wear a supportive brace for 6 months. She got this brace removed 3 months prior to today's visit. Her cancer was active for about 3 to 4 years before going into remission after a mastectomy and chemotherapy. While recovering from her mastectomy and her last bout of chemotherapy, the client developed a DVT in her leg, and she was hospitalized for that and was put on anticoagulations. Both the DVT and the cancer going into remission were about a year prior to this visit. The purpose of today's visit is to follow up and discuss any new health concerns. You will see examples of the somewhat fused relationship between Becky and Christina and the decision of Dr. Alwarith to invite her behavioral health colleague to join the visit.
Come in.
Hello, Becky and Christina. Good to see you both. Becky, how are you feeling?
I'm doing well. Ever since I got my cast removed, I've been able to rest a lot because of Christina.
I remember talking about that on our last visit, the fear of not being able to fully recover from the surgery. I also remember you were concerned about your energy levels since you had just stopped chemotherapy. Is that still an issue that you're having?
That's actually why we came back for this visit, Dr. Alwarith. Mom has not really been herself the past couple months. I've been trying to help her as much as I can because I know she does not have a lot of energy due to the recent chemo and the mastectomy procedure. Also, the hospitalization for the blood clot wore her out as well. It all has been a lot for Mom. Even the medication from our last doctor for depression does not seem to be working.
Well, it's working some, I think. My last physician suggested that I see a therapist, but since he gave me that medication, Christine and I wanted to see how that would help me before we actually went and saw a therapist.
Yes. Okay, I do remember talking about that as well. That was mentioned in your last visit. I can understand the decision to try the medication first. How did your husband feel about the decision to just try the medication for a while?
Well, we don't like to bother Dad with those details. He works a lot, so Mom and I kind of made that decision together. But he is very supportive of whatever helps Mom, and I am as well. It just seems like nothing is working.
Well, yes. I mean, work schedules can be frustrating, but it sounds like he's still supportive of your recovery, Becky. So you said that you think the medication might be working. Can you tell me a little bit more about why you think that?
Well, I really have been able to rest and recuperate over the last couple of months and focus on that. So maybe the medicines help me in that way. But to be honest, I'm not sure how the medicine's supposed to be helping me because I am tired all the time.
Okay, so what I'm hearing is little energy. What about your overall interest in activities like taking a walk or doing laundry?
I don't know. I mean, I feel like I want to do certain things, but I also feel like I can't do those things. It's kind of confusing, really.
Well, I mean, sometimes it is hard to figure out what we actually want to do, especially if you have low energy levels. Also, while we talk, do you mind if I look at your ankle?
Oh, sure. Yeah, no problem. Let me just take off my shoe.
Yeah, Mom, let me help.
Okay. Do you feel any pain in the foot right now, Becky? Like maybe when I flex. Go ahead and flex your foot. Do you feel it?
No pain that way, but I do feel some pain when I kind of bend it certain ways.
Okay. Well, that's good. What about any of the other symptoms that you felt last year with your blood clots? Have you felt those again?
No, Not at all.
Okay.
Thank goodness.
Okay. Well, I mean, that is good to hear. However, if it's okay with you, I'm going to schedule an ultrasound just to be safe since you have a history of blood clots.
And I think that's a good idea.
Also, your ankle looks like it has almost fully recovered. So that is a plus. Did you do any of the physical therapy appointments? I believe physical therapy was in your insurance plan, correct?
Well, we went to the first appointment and it seemed simple, so I just got a copy of the exercise and have been helping Mom with the stretches. I think the actual exercises are a little too much for her.
Becky, do you feel like the exercises are something you cannot handle because of your low energy right now?
Well, I do believe that I can do some of them, but it is my energy level. I mean, when Christina's not home, I really struggle to even get out of bed. She helps me so much.
It sounds like Christina is a very big help, though I am concerned about your energy levels. How do you feel about me doing some blood draws and see if that gives us any more information? And while our nurse does that for you, do you mind if I pull in one of my colleagues to talk about goal settings, stress, and overall mental health? I think it would be helpful to have that conversation to see if we can create a plan to address this lethargic state that you seem to be in. Would that be okay?
I think the blood draw would help because it is a problem that might have to do with her past chemotherapy treatments.
Yeah, I think both would be good.
Come in. Oh, hey, John. Becky and Christina. This is John, and he's our behavioral health provider on staff here. We believe that health should be treated holistically, so this means that we want to treat your physical, mental, social, and spiritual health. Therefore, I pulled in John to collaborate with me on your healthcare and future treatment plan. John usually has discussions with patients about things such as health goals, stress, and mental health. However, his discussions are not limited to those things. John, would you like to add anything else?
Thanks for the introduction. Like Dr. Alvarez said, my name is John, and my pronouns are he, his, him. Dr. Alvarez did a good job on some of my role here, but I just want to ask if you have any questions.
So is this like therapy?
It's more like a path to a complete treatment plan for Becky. I might ask some questions that may make it feel like therapy, but overall, this is a brief encounter that Dr. Alvarez and I will use to create the best treatment for Becky. So it's kind of like therapy, but more directed towards your health goals and overall health outcomes.
That makes sense to me. How about you, Mom?
Yeah, I think I understand.
All right. So, Becky, before we begin, I always like to ask this of everyone I see. I know Christina is your daughter, but I also know that conversations about mental health can be very personal. Would you like Christina here for this conversation?
I don't mind her being here.
Okay. Well, if it's okay with you, Becky, I'm going to summarize our previous conversation for John so he's caught up to speed.
Okay, sounds good.
Great. Well, John, Becky here has been recovering from a couple of different procedures and health issues. The major ones are her last sessions of chemotherapy because her cancer went into remission. And with that, she also had a mastectomy. So, Becky, am I missing anything about that part of your story?
Well, do not forget the blood clot that happened right before her cancer went into remission.
Yes, she is recovering from a procedure and was taking anticoagulants for a DVT that was in her leg. All of this happened about a year ago, along with a fractured ankle. Becky, would you like to tell John about your fractured ankle?
Sure, it's a little embarrassing, but I was walking my dog and I somehow got tangled in the leash and I fell hard on my ankle. I had to wear a cast for 6 months and I just got it off about 3 months ago.
Yeah, she was doing pretty good before that fall. And then I had to start helping more since she could not walk.
So, as you can see, John, Becky has been through a lot in the past year, but I think we can narrow our treatment plan to focus on a couple of things. Becky, Christina, and I are all concerned about energy levels, and I know that I'm concerned about Becky's overall independent functioning as well. I'd like to see some more activity in her recovery, especially since she has a history of blood clots. Becky, do you think those would be good focus areas? Energy levels and independent functioning?
Yeah, I think it's fine, right, Mom?
Yeah, I think I would really enjoy getting back into walking. It's something I really liked to do, so yeah.
Becky, I think walking again is a very doable goal. I also think it aligns with Dr. Alvarez's concerns and goals as well. Let's focus on how we can get you back to some daily walks and other light exercises.
I think that sounds like a good plan.
Gotcha. Also, I know that Dr. Alareef might have to leave soon to get to her next patient. This means that even though the Dr. Alareef might not be present for the whole conversation, she still has access to my notes, which will recap our overall conversation. That way we can collaborate on your healthcare together.
That is perfect timing, John, because I do have to step out to see my next patient, Becky and Christina. John and I will get together later today to talk about this conversation and create a joint treatment plan for your health, okay? So I'll also follow up with you about your blood work and let the front desk know about your ultrasound appointment. Lastly, and maybe you can talk to John about this, but I do think that physical therapy would help as well.
Okay, thank you, Dr. Alareef.
Absolutely.
Thank you.
Have a good one.
Thanks.
So I am curious, Becky, you said that you want to walk again and enjoy it again. When do you think was the last time you were able to do that?
Honestly, I think it was about a month after that she finished her chemo, right, Mom?
Yeah, I think that was the last time. My energy levels were still low, but I feel like I was able to do more physical activity, and then I broke my ankle.
I see. So it sounds like you were still tired, but maybe had more desire to walk and do physical activity then?
Yeah, that's how it was.
Gotcha. I am curious, what do you think was the difference for you back then?
Well, I think that she was physically able to do those things back then. Now she just needs so much help.
I mean, I think I need help right now, but I honestly feel the same physically that I did back then. It's just that my energy levels and my body won't let me do those things.
That is very interesting, Becky. You said something that differed from what Christina said. Christina said that you're not able to physically do these things, but you believe you can do those things. Is that correct?
Yeah, yes.
I did not know you felt that way, Mom. I always assumed you needed the help.
Well, I thought I wasn't able to, but I really do think that I can do these things.
Okay. We're heading in a good direction because, Becky, you're making statements that sound like you believe you can act more independently. I am wondering if we could focus on that and maybe create a plan to turn your belief into action. Would that be okay?
Yeah, I think so.
So, Christina, you seem surprised by your mom's determination. Why do you think that is?
Well, I think I'm just surprised because I want to help Mom, and I'm trying to do that around the house and with her physical movement as well.
Christina, you help me so much. I don't have to cook or clean because of you.
Thanks, Mom.
So what I'm hearing is that, Becky, you feel that you can do things by yourself. And you're also very grateful for Christina helping you these past several months. Is this correct?
Yeah, I guess it is.
I am wondering, Christina, when was the last time that you let your mom do something like cooking or cleaning by herself?
Well, I think it has been since before she broke her ankle. So I think a little under a year.
Okay, so it sounds like you've been such a great help for your mom while she's recovering. However, I am curious if we can plan for your mom to do these things by herself more going forward. Becky, do you feel like you can do these things by yourself more?
Yeah, I think I'd be able to.
What if we look at physical therapy as the first step to those independent activities? I wonder if you can go to physical therapy and have a couple of sessions for your ankle.
Yeah, I told Dr. Alareef that we went to the first appointment and then have just been doing the stretches and such at home.
That makes sense. But I am curious to find out how you feel about Becky going to physical therapy and doing a couple of appointments. Maybe Christina or your husband could drive you.
Yeah, Dan has been saying that he wants to start walking with me again. We used to do that before all of this happened.
I always thought Dad was so busy. I didn't know he wanted to help you, Mom.
Christina, I am wondering how do you feel about hearing this?
A little confused, but I'm glad that Dad wants to walk with Mom. I just want to make sure Mom gets the help she needs.
I am curious if maybe your mom can get the help she needs through physical therapy, and this could allow you to decrease your help and maybe have more time.
I think that's a really good idea. Christina, you could focus on going to college, like we've talked about.
I've been applying to them, but I also thought I would have to stay home and help you. So, yeah, sounds like a good idea.
This could be a shift for everyone since the way you all have been functioning has been so different the past year or so. But it sounds like starting with physical therapy is a good first step. What about also doing some more cleaning and cooking tasks around the house, Becky?
I mean, I am really bored relaxing all day, honestly, so it would give me something to do.
I think that is a good way to look at it.
I think that could be a good plan. Mom, I can still help you if you need it.
So to summarize, we plan to go to physical therapy and maybe ask Dan about taking you to some of those appointments. We also plan to do a little more activity around the house. How does 1 to 2 activities a day for the next week? Or we can continue to grow on that number.
Yeah, I think I can do 1 to 2 activities a day.
I think that can be done as well.
Good. This is great. I know that we did not get to talk about your depression medication that you received from your last primary care provider. Could we schedule another session to talk about plans for this medication and maybe talk about your depression a little more?
Yeah, I can do that. And maybe Dan could take me to that session as well.
Yeah, if he isn't working.
I think that would be a good idea. Well, I'm glad we came up with a plan. Let me walk you both out and we can schedule that session for you at the front desk. We could also plan for Dr. Auerreef to update you on all your tests at that session as well.
Sounds good to me.
Yeah, I think that sounds good too.
During this visit, Dr. Auerreef recognized the need for the patient to become more independent and focus on behavior change. She completed a warm handoff to John, who then made a treatment plan with the patient and daughter. After the family leaves, John updates Dr. Auerreef on the treatment plan, who then records the plan in the patient chart. This case is an example of how clinicians work together to engage patients and family members in treatment.